The incidence of colorectal cancers is increasing globally as well as in India. I am Dr. Dattaram. I am a consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. So today let us discuss about some common symptoms of colorectal cancers. The importance of this is because a cancer has to be diagnosed very early for curative treatment. As you all are aware of, that most of the cancers are asymptomatic to start with, or the symptoms are very trivial or very minor. By the time they cause symptoms, the cancer is usually advanced. Then the treatment can be very difficult. So let us understand what are the symptoms of colorectal cancers. If you have a change in bowel habits, so that's a very important symptom. What does this change in bowel habit mean? If you are changing the frequency of bowel movements, say if you are passing stool once or twice in a day, then increased frequency of stools can point towards colorectal cancer. Changing the consistency of stools, the stools become little loose and you are passing loose stools more often, then that could be a change in the bowel pattern that may point towards a colorectal cancer. Yet another important symptom is passing blood in stools. Passing blood in stools is due to the bleeding from the tumor. So usually what we see, the blood is mixed with stools. This is a very important symptom. Some patients do notice a lot of mucus in stools. Feeling of incomplete evacuation. So what is this feeling of incomplete evacuation? Patients with rectal cancers classically have this symptom. When they go to the washroom, they evacuate stools, but they still feel incomplete. They need to go to washroom again and again. They go to the washroom again and again to empty the bowel. But they are not able to empty. This is a classic symptom of rectal cancer, and this is called as feeling of incomplete evacuation. Some patients have an intense urge to evacuate early in the morning. So when they get up from the bed, they rush to the toilet, but they are not able to pass. This is called as spurious diarrhea. This is yet another important symptom which can point towards a colorectal cancer. Having lower abdominal cramps, abdominal gas bloat, this could be a symptom of colorectal cancer. Yet another important thing is having anemia or low hemoglobin. So the cancer bleeds and they present with anemia or low hemoglobin. In my clinical practice, I have seen some patients, especially patients who are having heart disease. So they are taking antiplatelets like clopidogrel, aspirin, etc. And when they come with low hemoglobin and we do a colonoscopy, many of them we are picking up colon and rectal cancers and gastric cancers. Patients who are taking antiplatelets, and if you find low hemoglobin, it is very, very important to get evaluated for a colon cancer or a gastric cancer, because the source of bleed could be in the gastrointestinal tract. So how do we diagnose this? How do we pick up this colorectal cancer? What I am saying now is going to be a very, very important thing. There is one simple test